presentation, we will be discussing falls and fall prevention among the elderly population, which is considered any individual 65 years of age or older. This presentation is done by Jenna Carter and Skylar Dendino. To begin, the definition of a fall according to Stats Canada is a sudden and unintentional change in position resulting in an individual landing at a lower level, such as on an object, the floor, or the ground, with or without injury. Falls are the leading cause of injury-related hospitalizations among Canadian seniors, and between 20 to 30% of seniors fall each year. The prevalence among older seniors who are 80 years and older is even greater. These falls harm not only the injured individual, but their family, friends, healthcare providers, and the healthcare system. Therefore, it is important to understand injury prevention activities. Falling can lead to negative health outcomes such as fear of falling, loss of autonomy, and greater isolation, as well as confusion, immobilization, and depression. Research shows that over one-third of seniors who are hospitalized for a fall are discharged to long-term care, which is almost double the proportion who are living that kind of care when they fell. In addition to health consequences, significant financial costs estimated at $2 billion annually, which is 3.7 times greater than that for younger adults. Lastly, the stat which is extremely concerning is the fact that the number of deaths due to falls increased by 65% from 2003 to 2008. Moving along with introduction and background, this chart shows the type of fall-related injuries among seniors. The majority of falls result in broken or fractured bones, which is 35%, or a sprain, strain injury, which is 30% of falls. Hospital data shows that seniors who are hospitalized for a fall remain in the hospital an average of 9 days longer than those hospitalized for any other cause. This draws attention to the disproportionate healthcare costs of fall-related injuries in comparison to other causes of hospitalization. Most falls occur as a result of compounding factors that combine and overwhelm an older person's ability to maintain or regain balance. The first risk factor is biological, which refers to those related to the human body and the natural aging process, as well as the effects of chronic or acute health conditions. Conditions associated with aging which are contributors to falling include acute illnesses such as weakness, pain, and dizziness, balance and gait deficits, chronic conditions and disabilities such as Parkinson's disease, diabetes, arthritis, and effects of a stroke, cognitive impairments, low vision, which increases the risk of falling by 2.5 times, and muscle weakness and reduced physical fitness. The second risk factor is behavioral, which includes actions, emotions, or choices of the individual. This includes assistive devices, fear of falling, footwear and clothing, history of previous falls, inadequate diet, medications, risk-taking behavior, and vitamin D intake, which is linked to bone and muscle strength. An additional factor is excessive alcohol consumption. A study showed 22% of patients seen in an emergency department for a fall tested positive for alcohol, although this number decreases with age. The third risk factor is social and economic risk factors, which includes social networks and socioeconomic status. Lastly, environmental risk factors are associated with the physical environment, such as the design of the building, entrances, outdoor spaces, and the type of furniture in the room. This can be broken down into factors in the community, factors in the living environment, and weather and climate. Moving on to prevention and intervention. 50% of falls occur in the home, whereas residential institutions account for 17% of falls, with that
I don't
being
think I
said,
do.
we will now discuss the ways to prevent falls in the home. There are several ways to do this. Assistive devices and other protective equipment. An example of this would be hip protectors. These are padded undergarments to be worn. Although this does not prevent the fall from occurring, it can prevent fractures as it softens the impact during a fall. Other preventative equipment would include hand railings, bathtub handles, and walkers. Education. It is important that healthcare professionals have the proper education and training on prevention and awareness of the prevalence of falls among seniors in order to educate their patients and the patients' care providers on the necessary tools and equipment to prevent falls. Exercise programs. These are used to develop greater strength and balance to prevent falls. Medication review and modification. Reviewing medications and removing inappropriate medications is shown to reduce risk of falling. Additionally, modifying medications that alter moods such as psychotropics can reduce the rate of falling. Vitamin D. The most important supplement seniors require is vitamin D, which is where supplement deficiency is often seen. Vitamin D is important to absorb calcium, which promotes bone growth and prevents muscle weakness and osteoporosis among the elderly. And lastly, vision referral and correction. It is crucial seniors have their vision formally assessed and any abnormalities should be treated in order to ensure their safety. Looking now at evidence-based information, we found a study that tested the safety benefits of home modifications such as handrails for outside steps and internal stairs, grab rails for bathrooms, outside lighting, edging for outside steps, and slip-resistant surfacing for outside areas such as decks and porches. A single blind cluster randomized control trial of households from a region in New Zealand with individuals receiving state benefits or subsidized was the focus of this study. Households were randomly assigned to the treatment group receiving immediate home modifications or the control group, where there was a 3-year wait before modifications were done. Households were observed for 1,148 days, and the rate of fall injuries per person per year was analyzed. A 39% reduction in the rate of injuries caused by falls at home per year was seen in the treatment group. Therefore, the study found that low-cost home modifications and repairs can reduce the risk of fall-related injuries in the general population. Although this study was random and had a sufficient sample size, it did not take into account the physical abilities or previous exercise history among these subjects, which is a major flaw in the study. A person with better physical abilities will be at a lower risk of falling than those with minimal physical abilities.
Helping the elderly against falls. There are different ways in which the elderly can seek assistance in preventing falls. This includes community fall prevention programs, internet resources, and participating in exercise programs. Community fall prevention programs. The Government of Canada offers free of charge community programs to people over the age of 65 in order to prevent the occurrence of falls. Exercise classes focused on improving strength, balance, and mobility are offered to those who attend the classes and are conducted by licensed physiotherapists and other healthcare professionals. Information on fall prevention is also provided, which includes tips on how to create a safer at-home environment. More information on the community fall prevention programs and places where you can attend a class can be found in the link below. Hospital programs. Many may think that the elderly are less likely to suffer from a fall in a hospital setting. However, hospital falls are still extremely common among the aging population. During their hospitalization, 3 to 20% of inpatients experience a fall at least once, with 30 to 51% experiencing some type of injury. Of those inpatients, 6 to 44% experience a fatal injury such as excessive bleeding. This warrants a need for hospitals to create a fall prevention program, which many have developed. For example, Sunnybrook Hospital has developed and provides a fall prevention program located in the H wing of the facility. The program begins with the consultation with a physiotherapist and geriatrician in order to assess and determine at-risk people over the age of 65. Following the consultation is a 6-week group exercise program conducted by a physiotherapist with the focus on building strength, balance, and mobility in the attendees. Luckily, this program is not only for inpatients, but is open to anyone over the age of 65 who are at risk of falls. For information on the Sunnybrook program, visit the link below. Lastly, there was a measured 25% reduction in the occurrence of falls due to hospital prevention programs, so it's definitely worth a try for those who are at risk. Internet resources. The Public Health Agency of Canada provides good, useful information on their website on the prevention of falls. This information provides insights on how to keep your home safe, proper nutrition, the use of aids, proper use of medication, and even tips on how to fall in order to decrease the chances of serious injuries and recuperation after suffering from a fall. National Council on Aging. The National Council on Aging provides some useful information on various programs that the aging population can join in order to decrease chances of falls from occurring. Programs such as Fallscape and Tai Chi for arthritis give the elderly an active and meaningful option for preventing falls. Participating in an exercise program. Degenerative disorders such as sarcopenia will increase the risk of falls occurring due to reduced physical performance. Balance and strength exercises have been chosen by an expert panel in having the best benefits against falls occurring in the elderly. Balance and strength exercises can be performed at the comfort of one's home using body weight and simple, low-cost exercise equipment such as resistance bands. Elderly people partaking in balance and strength exercises are encouraged to use light to hard intensity while performing these exercises, which is different to each individual. In a study conducted by Schwind and others, the board rating of perceived exertion was a scale used to determine the intensity that participants should be using for these exercises. This scale ranges from 6 to 20 points, 20 being maximum effort, and it is advised that the exercises should be conducted at an intensity of 10 to 16 points, just to give you an idea. Older people are encouraged to visit a therapist in order for intensity adjustments every 2 weeks. Please view the YouTube link provided. The 1989 Life Call commercial became highly popularized in social media and pop culture. Although it may not have been as popular when first released, this commercial gained a lot of attention over Miss Fletcher's famous line, "I've fallen and I can't get up." The commercial, though perhaps not acted out as accurately as in reality, does hold some truth. The fact is, many falls which occur with the elderly result in a fracture. Wrist fractures are very common as a result of falls between the ages 65 to 75, and hip fractures are more common once past the age of 75. It isn't hard to imagine how difficult it would be to get back up after suffering from a fracture of the hip, especially if coupled with a degenerative neuromuscular disorder such as sarcopenia. Miss Fletcher's line in the commercial, even though depicting a serious scenario, became a joke to many, with several parodies of the commercial and comedic images surfacing across the internet. Though the commercial was promoting a useful piece of technology that could come of great assistance to those at risk of falling, many people only took it as a joke. This is unfortunate because this draws people away from the serious issues of falls in the elderly and the serious health effects of these falls. Life Call commercial and ageism promotion. From your first view of this commercial, it is easy for one to assume that the older population are just frail and brittle beings who are unable to safely live independently. The product in commercial is directed at the older population, even though it could have practical use with anyone. Any ill person with a life-threatening disorder or disease could find use in this alert system. Even children could use it in a situation which warrants it, such as serious injury and even abduction. The commercial only shows one side of the older population, which is disabled and ill, without blatantly saying that the product is directed towards them. Without further research, one may think that these situations are common for all older people, when there are still some healthy and active older people who are not in a serious risk of the portrayed scenarios occurring. Philips Lifeline is a more recent version of the LifeCall product and provides a more understanding view on the events of falls in the older population. Whereas the LifeCall commercial only shows an older lady falling on the floor, the Philips Lifeline commercial makes it clear early on that the following occurs with anyone. LifeCall also only shows the older population in 4 different scenarios, which is from a hospital bed, lounging in a chair, during a medical emergency, or after suffering from a fall. These scenarios can make it seem that the older people are not active or independent. Philips Lifeline, although not miles ahead of the LifeCall commercial for reducing ageist views, does a better job at portraying the older population by showing them in a scene of them doing an active job apart of normal life. The Lifeline commercial does show a post-fall situation, but does not only show the negatives of aging and uses testimonials in place of various scenarios that an elderly person may face. Negative scenarios, that is. Internalization. It is very possible for an older person to take the LifeCall commercial and internalize both the message being portrayed in the commercial as well as the influence it has had on society. If an elderly person was to see the jokes being created due to the LifeCall scenario, they could easily be offended due to the fact that the society is making fun of a situation that is extremely serious and dangerous to them. Internalizing these beliefs can lead to diminished self-confidence and self-image, which could lead to reduced motivation to be physically active, which is a big preventative measure for falls. The older population have an increased fear of falling if a fall has already occurred, and seeing the LifeCall commercial can make this a more substantial fear, which could result in the elderly refraining from physical activity, which could actually make falls more likely due to atrophy of muscles and loss of strength.
In conclusion, falls are the leading cause of hospitalizations among seniors, which can cause serious injuries and can have a lasting impact on the individual, their family, and society. There are many risk factors associated with falls, but there is also a number of prevention and intervention techniques. It is shown that inexpensive equipment used in the home can reduce the risk of falls, and there are also various government programs to assist with education and prevention. This is the end of our presentation. The following 3 slides are our references. Thanks for watching.